Thanks for watching. This is my weekly update on coronavirus and other things in the news in medicine. Some of the big news is the surges in patients and illnesses that are happening in the South, especially Florida and Texas, are seeing record numbers. And this is what I've said from the beginning, and most everybody said, is this virus is not going away. Dexamethasone was in the news. And this is out of the United Kingdom and out of the University of Oxford. And a study was done that started back in February with this illness. So even way back when, they were trying to decide what's the best way to treat this. And we've always wondered if steroids would help in treating a systemic inflammatory response like SARS-CoV-2. So a lot of what happens with SARS-CoV-2 or COVID-19 illness is the virus itself. The virus has its effects, toxic effects on our cells, on our body, and it causes our illness. But a huge part of what happens to us is our own inflammatory response, our own body trying to fight off the virus. So our own immune system. So dexamethasone is a steroid. It's a steroid that suppresses all of our immune system indiscriminately. And there's a lot of negative things about that. But if you're severely ill and your lungs are inflamed, and it's mostly because of your inflammatory system, giving some steroid theoretically could help. Now, remember last time I did this, I said that steroids hadn't been shown to help yet and they shouldn't be used. Well, that was true then, but now there's studies, and now the latest study out of Oxford shows that dexamethasone or a steroid did help, and it was pretty exciting news. So seriously ill people on a ventilator, they had to have a ventilator to help breathe for them. They were so sick with pneumonia. When they took a course of dexamethasone, they had a third less deaths. So 33% reduction in death. Those who were seriously ill and just on oxygen, not on a ventilator, so they weren't as sick, had a 20% reduction in mortality. So that's big news. We know now that dexamethasone should help. Now, that's preliminary. They released the preliminary results of their study at Oxford University, but it hasn't been published. It hasn't been peer reviewed. So we need to be careful about that, but already a lot of people in a lot of countries are advocating the use of dexamethasone, but it does look promising. The other thing that I already talked about was remdesivir. Remdesivir is an antiviral medication, and it decreased the length of an illness from an average of 15 days to 11 days. So another promising therapy, antiviral, remdesivir. So the other thing I want to talk about today, and this wasn't just in the news, but the lessons from the Diamond Princess. There were some articles about this in the New England Journal of Medicine and looking at some of the numbers. So I got some of my numbers from there. The Diamond Princess, remember, was a cruise ship, and on February 1st of this year, one of its passengers got off in Hong Kong, and soon after he was in Hong Kong on February 1st, he was diagnosed with COVID-19. So they knew that ship had been exposed. So on February 3rd, when that ship reached Japanese waters, the Japanese government quarantined it. It wouldn't let it come to port. And they had to stay out. Now, the Japanese government also did a lot of testing on those people. Eventually, they brought some of them to a Japanese hospital, and they followed them, and they kept the numbers, and they watched and saw. So, very interesting. 3,700 people on that ship with crew and passengers. 712 became infected. So that's about 20% of everybody on the ship became infected. Now, another interesting fact, out of those 712, 410 or 58% didn't get sick. They were infected, so they had an asymptomatic infection. And we know that. There's been a lot of talk now about asymptomatic carriage and how that spreads around to people, and it does. People who have the virus but have no illness can spread it, and there are people walking around like that. Thankfully, there's not a lot. Antibody studies will let you know about how much asymptomatic carriage there is. And I talked about this earlier in the Boston study and the Spain studies. It showed that there was probably on average, I'm kind of extrapolating a bit, about 5% of the world's population have been exposed to it. So there's a lot of asymptomatic carriers because only about 1% of the world's population have been infected. That's been confirmed. All right, what do we learn from that? Well, what would have happened if we hadn't taken the precautions we did? Because that's basically what happened on this cruise ship. This cruise ship was a microcosm of what could have been. 3,700 people, 20% of them became infected. At this point, in the world's population, we've only got like a couple percent that have become infected, and that's after about 6 months of this virus. In the space of just a couple weeks, 20% on this cruise ship became infected, and that's when they had some warning. When this person was diagnosed, and before there were a lot of sick people. So if we hadn't taken the precautions we'd taken, if we just kind of let it come through and we saw other people get sick and then we started uh, uh, taking precautions, it would have already taken hold, and maybe we'd be looking at 20% of our population being infected instead of 5%. Big difference. Another way to look at this is the H1N1 pandemic of 1918. That was the flu. Now, that one was worldwide also. 500 million people were infected. That was a third of the Earth's population. Probably everybody else was infected too, but they just didn't know it. They didn't do antibody tests back then. So they were probably all exposed to it by the time it was over, and that's why it finally ended. How long did the H1N1 flu of 1918 last? Because you kind of want to know, how long is this one going to last? It was 15 months long. 15 months long, but that was after probably most of the world had already come in contact with this virus. So they'd either been infected and had an illness, or they were asymptomatic and infected. I would say most of the world had already had it at that point. 15 months. We're only 6 months into this one. Now, if we continue on this with no vaccine and no other intervention, and we continue to infect people slowly, we got years to go. Years. We're only like 5% of the population being exposed to this. So it takes a long time. A vaccine will change all that. And if we can get an effective vaccine, we'll probably get several vaccines. And when they come out, we can evaluate how good they are. So that's what's new. Dexamethasone is a help. That was kind of some big news. And, we really are doing the right thing and continuing to take precautions and being careful, because this virus is not going away.